Hello, my name is Dr. Stanley Lang. Welcome to this video, the subject of which is how to control anxiety. How to control anxiety. Now, the reason I'm sharing about this subject today is because of a patient that I saw today that is probably suffering from more anxiety than I've seen in a long time. And her story was one of many years of suffering with this problem. And so several things happened that I thought were helpful to help you to understand different things that you can do to help control anxiety, but also the limitations of controlling anxiety if you're not willing to use a whole person health or a holistic approach that's health of body, mind, and spirit to your wellness strategies and trying to overcome conditions like chronic anxiety. So the person who I was dealing with in this encounter had been treating for anxiety for the last 15 plus years and had been taking some medication for it. And in the last couple of years, symptoms had gotten a lot worse. And she was desperate to try to find some solutions that didn't involve taking more medicine. She wanted solutions that were not medicine-based. So we reviewed the different parts of this whole person health strategy. And so there are several things that can be done simply from a physical perspective, which she was partly doing, some of it was she was not. The first thing that I can say she was doing was that she was eating organically, which means that she was cutting out a lot of the chemicals in the diet that make people ill and increase their anxiety if they have anxiety issues. What she wasn't doing was having a regular exercise program. She was physically active, but did not have a regular exercise program. And so one of the first things I always recommend patients to do is a 30-minute vigorous walk every day, rain or shine, doesn't matter. The only exception being if there's ice where you have to walk. And the reason for this is complicated, so I'm not going to go into the why of it, but just to say that if you're trying to improve symptoms of anxiety or depression, a daily vigorous walk is one of the most powerful and simple things that you can do. The second thing that she could do in the physical realm was to eat in a low glycemic fashion. Now, low glycemic means eating in ways that don't raise the blood sugar quickly. Now, the reason that that helps to control anxiety is because if the blood sugar raises quickly, it causes your brain chemistry to, let's say, bounce around, and the brain, some of the neurotransmitters in the brain sort of oscillate up and down like this if the blood sugar is doing the same thing. So by eating in a way that doesn't cause the blood sugar to bounce up and down a lot, that helps with the control of anxiety in a dramatic way. We also talked about avoiding MSG and other food additives, which she was already doing. So in the emotional health part of the triangle, there wasn't much I could offer her here because she was an expert in counseling. She'd been in counseling for more than 10 years, and she pretty much could anticipate what a counselor would tell her. So some of the little tricks that counselors can throw out to somebody to help them diminish their anxiety, she couldn't really add to what she was already doing because she was already doing all the things that counselors tell her to do. So I didn't really have much to add to her for that part of the triangle. And then the third part of the triangle is spiritual. Now, I have several strategies, at least four very simple strategies, but very powerful strategies that help to decrease anxiety by using spiritual resources. The problem was, in this case, the person wasn't open to spiritual solutions. That wasn't a big part of this person's life. And so basically, we had to cut that part off. She was already using everything there, and that left the few physical things that I just talked to you about. Now, those will help. The other thing that I forgot to mention that we talked about at length is cutting out gluten out of her diet, because in some cases, gluten is triggering increased anxiety in some people. And the mechanism for that is also quite a long video, so I'm not going to go into that. But just to say that if you're dealing with anxiety and you're trying different ways to try to decrease symptoms, cutting out gluten, 100% cutting out gluten can be a very powerful thing that helps with your mental health. Now, also in the physical realm is the role of different nutritional supplements, especially vitamin D, making sure that your vitamin D level is in at least the mid-normal range, not just barely normal. There are multiple other nutrients that play a big role, but vitamin D is something that we can actually measure and identify whether it's actually low. There are a lot of other nutritional supplements that I would recommend down the road if the initial steps didn't work. But the thing that's really the most powerful thing, the spiritual health strategies that I have seen work over the years, weren't available to this person. Now, they are available to you if you're at least a little bit open to the spiritual life, and the spiritual life might actually be a very big part of your life. And if it is, and you're dealing with anxiety, one of the things that will help very much is learning how to pray the Jesus prayer. And in a different video at a different time, I'll go into more detail on how to do that. But the Jesus prayer is an ancient form of Christian prayer that teaches us how to sort of stay in the presence of God without asking God for a lot of stuff. It's kind of like sitting with a close friend around a campfire, but not talking. You're just in each other's presence. The Jesus prayer helps to do that, and it has a very healing effect for chronic stress and anxiety symptoms. So in summary, if you're dealing with anxiety and you're trying to think of what can I do, there are several things that you can do in all three of these realms. I didn't go into the emotional resources that are sometimes available because in this person's case, it didn't make any difference. But counseling is always available to anybody that's seeking it. But the particular emotional resource strategies that I have are deeply wedded to the spiritual resource strategies. So I can't really hand them out without teaching somebody about the spiritual resources, because I've wedded them together in the strategy that I use, and it works very well. So I wish you well in your search for health, and God bless, and have a great day.